Chapter 5. The Integumentary System, Types of Skin, Aging in the Integumentary System continued. With further aging, Langerhans cells dwindle in number and macrophages become less efficient phagocytes, thus decreasing the skin's immune responsiveness. Moreover, decreased size of sebaceous glands leads to dry and broken skin that is more susceptible to infection. Production of sweat diminishes, which probably contributes to the increased incidence of heat stroke in the elderly. There is a decrease in the number of functioning melanocytes, resulting in gray hair and atypical skin pigmentation. Hair loss increases with age as hair follicles stop producing hairs. About 25% of males begin to show signs of hair loss by age 30, and about 2/3 have significant hair loss by age 60. Both males and females develop pattern baldness. An increase in the size of some melanocytes produce pigmented blotching skin, or age spots. Walls of blood vessels in the dermis become thicker and less permeable, and subcutaneous adipose tissue is lost. Aged skin, especially the dermis, is thinner than younger skin, and the migration of cells from the basal layer to the epidermal surface slows considerably. With the onset of old age, skin heals poorly and becomes more susceptible to pathological conditions such as skin cancer and pressure sores. Rosacea is a skin condition that affects mostly light-skinned adults between the ages of 30 and 60 and is characterized by redness, tiny pimples, and noticeable blood vessels, usually in the central area of the face. Growth of nails and hair slows during the second and third decades of life. The nails also may become more brittle with age, often due to dehydration and repeated use of cuticle remover or nail polish. Several cosmetic anti-aging treatments are available to diminish the effects of aging or sun-damaged skin, including topical products that bleach the skin to tone down blotches and blemishes. Hydroquinone, or decrease fine wrinkles and roughness, retinoic acid. Microdermabrasion, the use of tiny crystals under pressure to remove and vacuum the skin's surface cells to improve skin texture and reduce blemishes. Chemical peel, the application of a mild acid, such as glycolic acid, to the skin to remove surface cells to improve skin texture and reduce blemishes. Laser resurfacing, the use of a laser to clean up blood vessels near the skin's surface, even out blotches and blemishes, and decrease fine wrinkles. Dermal fillers, injections of collagen from cows, hyaluronic acid or calcium hydroxyl apatite, or calcium hydroxyl apatite, that plumps up skin to smooth out wrinkles and fill in furrows, such as those around the nose and mouth and between the eyebrows. Fat transplantation, in which fat from one part of the body is injected into another location, such as around the eyes. Botulinum toxins, or Botox, a dilute version of a toxin that is injected into the skin to paralyze skeletal muscles that cause the skin to wrinkle. Radiofrequency non-surgical facelift, the use of radiofrequency emissions to tighten the deeper layers of the skin of the jowls, neck, and sagging eyebrows and eyelids. Facelift, brow lifts, or neck lifts. Invasive surgery, in which loose skin and fat are removed surgically and the underlying connective tissue and muscles are tightened. And thread lift, a non-invasive surgical facelift in which threads that have tiny barbs are inserted into the sagging facial tissue to gently lift and reposition them into a more vertical and youthful position. The clinical connection. Although basking in the warmth of the sun may feel good, it is not a healthy practice. There are two forms of ultraviolet radiation that affect the health of the skin. Longer wavelength ultraviolet A UVA rays make up nearly 95% of the ultraviolet radiation that reaches the Earth. UVA rays are not absorbed by the ozone layer. They penetrate the furthest into the skin, where they are absorbed by melanocytes and thus are involved in sun tanning. UVA rays also depress the immune system. Shorter wavelength ultraviolet B UVB rays are partially absorbed by the ozone layer and do not penetrate the skin as deeply as UVA rays. UVB rays cause sunburn and are responsible for most of the tissue damage that results in wrinkling and aging of the skin and cataract formation. Both UVA and UVB rays are thought to cause skin cancer. Long-term overexposure to sunlight results in dilated blood vessels, age spots, freckles, and changes in skin texture. Now there's a section here in parentheses, I want to just repeat. UVB rays cause sunburn and are responsible for most of the tissue damage, production of oxygen-free radicals that disrupt collagen and elastic fibers that result in wrinkling and aging of the skin and cataract formation. Exposure to ultraviolet radiation, either natural sunlight or the artificial light of a tanning booth, may also produce photosensitivity, a heightened reaction of the skin after consumption of certain medications or contact with certain substances. Photosensitivity is characterized by redness, itching, blistering, peeling, hives, and even shock. Among the medications or substances that may cause photosensitivity reaction are certain antibiotics, tetracycline, non-steroidal anti-inflammatory drugs, ibuprofen and naproxen, certain herbal supplements, St. John's wort, some birth control pills, some high blood pressure medications, some antihistamines, and certain artificial sweeteners, perfumes, aftershaves, lotions, detergents, and medicated cosmetics. Self-tanning lotions, sunless tanners, topically applied substances contain a color additive, dihydroxyacetone, that produces a tanned appearance by interacting with proteins in the skin. Sunscreens are topically applied preparations that contain various chemical agents such as benzophenone or one of its derivatives that absorb UVB rays but let most of the UVA rays pass through. Sunblocks are topically applied preparations that contain substances such as zinc oxide that reflect and scatter both UVB and UVA rays. Both sunscreens and sunblocks are graded according to sun protection factor, SPF, rating, which measures the level of protection they supposedly provide against UV rays. The higher the rating, presumably, the greater the degree of protection. As a precautionary measure, individuals who plan to spend a significant amount of time in the sun should use a sunscreen or a sunblock with an SPF of 15 or higher. Although sunscreens protect against sunburn, there is a considerable debate as to whether they actually protect against skin cancer. In fact, some studies suggest that sunscreens increase the incidence of skin cancer because of the false sense of security they provide. To appreciate the many ways that skin contributes to homeostasis of the body system, examine Focus on Homeostasis. The Integumentary system. This feature is the first of 10 found at the end of selected chapters that explain how the body systems under consideration contributes to the homeostasis of all other body systems. Next, in Chapter 6, we will explore how bone tissue is formed and how bones are assembled into the skeletal system, which is like the skin, in that it protects many of our internal organs. Focus on homeostasis. Contribution of the integumentary system. The body system. For all body systems, skin and hair provide barriers that protect all internal organs from damaging agents in the external environment. Sweat glands and skin blood vessels regulate body temperature needed for proper functioning of other body systems. This chart is explaining how the integumentary system maintains homeostasis in the various body systems listed. It maintains homeostasis in the skeletal system. Skin helps activate vitamin D needed for proper absorption of dietary calcium and phosphorus to build and maintain bones. In the muscular system, skin helps provide calcium ions needed for muscular contraction. In the nervous system, nerve endings in the skin and subcutaneous tissues provide input to the brain for touch, pressure, thermal, and pain sensations. In the endocrine system, keratinocytes in skin help activate vitamin D to calcitrol, a hormone that aids absorption of dietary calcium and phosphorus. In the cardiovascular system, local chemical changes in dermis cause widening and narrowing of skin blood vessels, which helps adjust blood flow to the skin. In the lymphatic system and immunity, skin is the first line of defense in immunity, providing mechanical barriers and chemical secretions that discourage penetration and growth of microbes. Langerhans cells in the epidermis participate in immune responses by recognizing and processing foreign antigens. Macrophages in the dermis phagocytize microbes that penetrate the skin surface. In the respiratory system, hairs in the nose filter dust particles from inhaled air. Stimulation of pain nerve endings in skin may alter breathing rate. In the digestive system, skin helps activate vitamin D to the hormone calcitrol, which promotes absorption of dietary calcium and phosphorus in the small intestine. In the urinary system, kidney cells receive partially activated vitamin D hormone from skin and convert it to calcitrol. Some waste products are excreted from body in sweat, contributing to excretion by urinary system. In the reproductive system, nerve endings in skin and subcutaneous tissue respond to erotic stimuli, thereby contributing to sexual pleasure. Suckling of a baby stimulates nerve endings in skin, leading to milk ejection. Mammary glands produce milk. Skin stretches during pregnancy as fetus enlarges. Mammary glands, by the way, are modified sweat glands. Disorders of homeostatic imbalance. Skin cancer. Excessive exposure to the sun has caused virtually all of the 1 million cases of skin cancer diagnosed annually in the United States. 1/2 of all cancers in the United States are skin cancers. There are 3 common forms of skin cancer. Basal cell carcinoma account for about 78% of all skin cancers. The tumors arise from cells in the stratum basale of the epidermis and rarely metastasize. Squamous cell carcinomas, which account for about 20% of all skin cancers, arise from squamous cells of the epidermis, and they have a variable tendency to metastasize. Most arise from pre-existing lesions or damaged tissue on sun-exposed skin. Basal and squamous cell carcinomas are together known as non-melanoma skin cancers. They are 50% more common in males than in females. Malignant melanomas arise from melanocytes and account for about 2% of all skin cancers. The estimated lifetime risk of developing melanoma is now 1 in 75, double the risk of only 20 years ago. In part, this increase is due to the depletion of the ozone layer, which absorbs some UV light high in the atmosphere. But the main reason for the increase is that more people are spending more time in the sun and in tanning beds. Malignant melanomas metastasize rapidly and can kill a person within months of diagnosis. The key to successful treatment of malignant melanoma is early detection. The early warning signs of malignant melanoma are identified by the acronym ABCD. A is for asymmetry. Malignant melanomas tend to lack symmetry. This means that they have irregular shapes, such as 2 very different looking halves. B is for border. Malignant melanomas have irregular, notched indented, scalloped, or indistinct borders. C is for color. Malignant melanomas have uneven coloration and may contain several colors. D is for diameter. Ordinary moles typically are smaller than 6 millimeters, about the size of a pencil eraser. Once a malignant melanoma has the characteristic of A, B, and C, it is usually larger than 6 millimeters. Among the risk factors for skin cancer are the following. Skin type. Individuals with light skin color who never tan but always burn are at high risk. Sun exposure. People who live in areas with many days of sunlight per year and at high altitudes where ultraviolet light is more intense have a higher risk of developing skin cancer. Likewise, people who engage in outdoor occupations and those who have suffered 3 or more severe sunburns have a higher risk. Family history. Skin cancer rates are higher in some families than in others. Age. Older people are more prone to skin cancer owing to longer total exposure to sunlight. Immunological status. Immunosuppressed individuals have a higher incidence of skin cancer. Burns. A burn is tissue damage caused by excessive heat, electricity, radioactivity, or corrosive chemicals that denature, break down the proteins in the skin. Burns destroy some of the skin's important contributions to homeostasis, protection against microbial invasion, and desiccation in thermoregulation. Burns are graded according to their severity. A first-degree burn involves only the epidermis. It is characterized by mild pain and redness, but no blisters. Erythema. Skin functions remain intact. Immediate flushing with cold water may lessen the pain and damage caused by a first-degree burn. Generally, healing of a first-degree burn will occur 3 to 6 days and may be accomplished by flaking or peeling. One example of a first-degree burn is a mild sunburn. Second-degree burn destroys the epidermis and part of the dermis. Some skin functions are lost. In second-degree burn, redness, blister formation, edema, and pain result. In a blister, the epidermis separates from the dermis due to the accumulation of tissue fluid between them. Associated structures such as hair follicles, sebaceous glands, and sweat glands usually are not injured if there is no infection. Second-degree burns heal without skin grafting in about 3 to 4 weeks, but scarring may result. First and second-degree burns are collectively referred to as partial thickness burns. A third-degree burn or full-thickness burn destroys the epidermis, the dermis, and subcutaneous layer. Most skin functions are lost. Such burns vary in appearance from marble white to mahogany-colored to charred, dry wounds. There is marked edema, and the burned region is numb because sensory nerve endings have been destroyed. Regeneration occurs slowly and much granulation tissue forms before being covered by epithelium. Skin grafting may be required to promote healing and to minimize scarring. The injury to the skin tissue directly in contact with damaging agent is the local effect of a burn. Again, the injury to the skin tissue directly in contact with the damaging agent is the local effect of a burn. Generally, however, the systemic effects of a major burn are a greater threat to life. The systemic effects of a burn may include a large loss of water, plasma and plasma proteins which cause shock, bacterial infection, reduced circulation of blood, decreased production of urine, and diminished immune responses. The seriousness of a burn is determined by its depth and extent of area involved, as well as the person's age and general health. According to the American Burn Association classifications of burn injury, a major burn includes third-degree burns over 10% of body surface area, or a second-degree burn over 25% of body surface area, or any third-degree burn on the face, hands, feet, perineum, which includes the anal and urogenital regions. When the burn area exceeds 70%, more than half of the victims die. A quick means for estimating the surface area affected by a burn in an adult is the rule of nines. Count 9% if both the anterior and posterior surface of the head and neck are affected. Count 9% for both the anterior and posterior surfaces of each upper limb. Total of 18% for both upper limbs. Count 4 times 9, or 36%, for both the anterior and posterior surfaces of the trunk, including the buttocks. Count 9% for the interior and 9% for the posterior surfaces of each lower limb as far as the buttocks. Total of 36% for both lower limbs. Count 1% for the perineum. Many people who have been burned in fires also inhale smoke. If the smoke is unusually hot or dense, or if inhalation is prolonged, serious problems can develop. The hot smoke can damage the trachea, the windpipe, causing its lining to swell. As the swelling narrows the trachea, air flows into the lungs is obstructed. Further, small airways inside the lungs can also narrow, producing wheezing or shortness of breath. A person who has inhaled smoke is given oxygen through a face mask, and a tube may be inserted into the trachea to assist breathing. Pressure ulcers. Pressure ulcers, also known as decubitus ulcers, or bed sores, are caused by a constant deficiency of blood flow to tissues. Typically affected tissue overlies a bony projection that has been subjected to prolonged pressure against an object such as a bed, cast, or a splint. If the pressure is relieved in a few hours, redness occurs but no lasting tissue damage results. Blistering of the affected area may indicate superficial damage. A reddish-blue discoloration may indicate deep tissue damage. Prolonged pressure causes tissue ulceration. Small breaks in the epidermis become damaged. Eventually the tissue dies. Pressure ulcers occur more often in bedridden patients. With proper care, pressure ulcers are preventable, but they can develop very quickly in patients who are very old or very ill. Terminology. Abrasion. An area where skin has been scraped away. Athlete's foot. A superficial fungal infection of skin of the foot. Blister. A collection of serous fluid around the epidermis or between the epidermis and dermis due to short-term but severe friction. The term bulla refers to large blister. Bulla. Callus. An area of hardened and thickened skin that is usually seen in the palms and soles is due to persistent pressure and friction. Cold sore. A lesion, usually an oral mucous membrane, caused by type 1 herpes simplex virus HSV, transmitted by oral or respiratory routes. The virus remains dormant until triggered by factors such as ultraviolet light, hormonal changes, and emotional stress, also called a fever blister. Comedo. To eat up, a collection of sebaceous material and dead cells in the hair follicle and excretory duct of the sebaceous oil gland, usually found over the face, chest, and back, and more commonly during adolescence, also called a blackhead. Contact dermatitis. Inflammation of the skin characterized by redness, itching, and swelling, and caused by exposure of the skin to chemicals that bring about an allergic reaction such as poison ivy toxin. Corn. A painful conical thickening of the stratum corneum of the epidermis, found principally over toe joints and between the toes, often caused by friction or pressure. Corns may be hard or soft depending upon the location. Hard corns are usually found over toes, joints, and soft corns are usually found between the fourth and fifth toe. A cyst. A sac with distinct connective tissue wall containing a fluid or other material. Eczema. An inflammation of the skin characterized by patches of red, blistering, dry, extremely itchy skin. It occurs mostly in skin creases in the wrist, backs of the knees, and fronts of the elbows. It typically begins in infancy, and many children outgrow the condition. The cause is unknown, but it's linked to genetic genetics and allergies. Frostbite. Local destruction of skin and subcutaneous tissue on exposed surfaces as a result of extreme cold. In mild cases, the skin is blue and swollen and there is slight pain. In severe cases, there is considerable swelling and some bleeding, no pain and blistering. If untreated, gangrene may develop. Frostbite is treated by rapid rewarming. Hemangioma. Localized benign tumor of the skin subcutaneous layer that results from an abnormal increase in blood vessels. One type is a port wine stain, a flat pink, red, or purple lesion present at birth, usually at the nape of the neck. Hives. Reddened, elevated patches of skin that are often itchy, most commonly caused by infections, physical trauma, medications, emotional stress, food additives, and certain food allergies, also called urticaria. Keloid. An elevated, irregular, darkened area of excess scar tissue, caused by collagen formation during healing. It extends beyond the original injury and is tender and frequently painful. It occurs in the dermis and underlying subcutaneous tissue, usually after trauma, surgery, a burn, or severe acne, more common in people of African descent. Keratosis. Formation of a hardened growth of epidermal tissue, such as solar keratosis, a pre-malignant lesion of the sun-exposed skin of the face and hands. Laceration, an irregular tear of the skin. Papule, a pimple, small round skin elevation less than 1 centimeter in diameter. Pruritus, itching, one or more common dermatological disorders. It may be caused by skin disorders, infection, systemic disorder, cancer, kidney failure, psychogenic factors, emotional stress, or allergic reactions. Topical, in reference to a medication applied to the skin surface rather than ingested or injected. Wart, a mass produced by uncontrolled growth of epithelial cells caused by papillomavirus. Most warts are non-cancerous. That concludes Chapter 5. In the next segment, we will cover the study guide, study outline for Chapter 5.